Welcome, everybody, to the Knuckle Dragon Billy Goat Review. This is Josh, and Mike is out and about. And today I am actually on location at one of our family friends, actually, Miss Tara Powell. Tara Powell, how you doing today?
I'm doing great.
Awesome. The premise of our show today, we did some episodes on medical type deals, ethics, and things like that. And I know that you've worked in the hospice industry. I don't know about industry. It kind of sounds canned a little bit, but the hospice field.
Yes.
And kind of want to learn a little bit more about that and maybe your role in it. So maybe you can go through like how you got into that field and we can
Sure.
go from there. So just take her away.
That's great. Well, I am a chaplain. I work at Good Samaritan Home. Been there for 2 years. I worked in hospice for about 7.5 prior to coming to Good Sam. And very similar in nature, other than at Good Sam, I get to do some of the things that were more related to church ministry as well. So I have 25 years of church ministry experience and about 10 in end of life. So I enjoy both.
Oh, really? That's kind of interesting, with end of life and especially with different religions and all that. We did a podcast, actually, Mike and I did, the buddy that we correspond, and we did it on euthanasia and just the different types, palliative care, the assisted end of life type
Sure.
deals. What's maybe your views on that, and especially being a chaplain? What necessarily do you think with that?
Well, of course, it's a touchy topic.
Oh,
and
definitely.
I have watched people that have, battled with terrible disease and really struggled through that. And I can understand why anyone might consider it, to be honest. I have compassion about just understanding wanting the pain to stop, especially when you know the end result is going to be death. But I also, I'm a firm believer in Jesus Christ, and I believe that there is a time and I think there's a time to be born and a time to die, just like it states in Ecclesiastes. And
Right.
I also believe that there's purpose in every breath we take. So I think even though we see suffering, I believe that when you're talking about end of life, I think that each moment matters. Knowing that you're going to die, I think, is a gift. I think you have time to, get closure within yourself. Okay. You have time to get closure within your faith. Get right with God,
Right.
so to speak,
get right with
or
your
with your
maker and all
Creator.
that. Okay, yeah.
To understand what your beliefs are. Have time to talk to your family. All those things, I think, death doesn't have to be the enemy. There is such a thing as a beautiful death and a beautiful ending.
Huh. That's interesting. Whenever we think death, and especially in American society, we think grisly, just really, like the Reaper is coming.
Absolutely.
And all of that, and I liked how you put it, a beautiful death. And more so with, it is a gift in a ways because that, yes, you are going to die.
Right.
With your body.
That's right.
I mean, your body's going to die. We all have that clock ticking.
That's right.
But at least I think what you're trying to say anyways is that, they know it's coming, so they can actually sit here and prepare their mindset more so to get right with it,
Right. To say what they need to say and do what they need to do. And, that in itself is the gift of time, which we don't get to choose,
Right.
And, something I tell my patients is that, our bodies wear out. They were never meant to last forever. So there will come a time when our body starts to deteriorate and it starts to wear out, but our spirit remains. So there'll come a time that our spirit can no longer be held by our body.
Right. And that's beautiful. So with that, your experiences with that, we talked about a beautiful death and coming to closure on that, just in your professional experience, and I don't want you to get in trouble with HIPAA or anything like that, but with your professional experience, how do a lot of people take that? I mean, how do they, I know there's stages of grief, the 5
Yes.
or 7 stages of grief,
Right.
you go through the, denial and anger and acceptance and all
Yes.
that. How do folks that know they're basically at the end of their life deal with that from what you've seen?
Well, Elizabeth Kubler-Ross, which is the one who came up with the stages of
Right.
death, grieving, she actually stated that she wished she'd never put that into stages because there's so much more to it. You know, each person is unique, each death is unique. So each, when I, you know, am encountering a new family, I really do my best to just open myself up to what they need and what they want. And sometimes that's challenging. You know, I have had a lot of experience with it, but I find most people want to talk about what's happening to them. Most people want to have conversations that maybe their families can't have. And that's where, you know, having a chaplain or someone that is experienced in end-of-life discussions can be helpful. Because we can talk about the unknown.
Oh, yeah,
we can talk
great unknown.
Yeah, we can talk about the things that scare them. We can talk about maybe, you know, I think that most people the reason why they fear death is because it's the unknown. It's the great unknown.
Oh, definitely.
Because people don't come back and tell you about it.
No.
So I think knowledge is power. And when we can give people some facts, when we can help them to have a little bit better understanding about what's going to take place, it usually calms them.
That is awesome. Yeah, like you said, you're talking about Kubler-Ross and the stages of grief. You know, it's not a linear path.
That's right.
You know, it's really not, you know, and, you know, we've all been through situations where we've grieved. I mean, it's a natural human emotion. We all grieve. We all grieve differently, you know, and for me, you know, the role of a chaplain, we kind of sort of know about. I know about chaplains in the service or things like that, but what's like a daily... I want to know what you do each day. Like, if you could just say, what's a typical day for you? Or maybe not so typical, maybe. I mean, I know that, especially with people, you know, people aren't going to say, well, I'm going to die at 4 o'clock this
That's
afternoon.
Right.
You know, it's
absolutely. Typical day for me is not a typical day because every day looks differently, but I kind of like that. I like the change. Every morning when I come in, you know, I do what most professionals do as far as checking emails and looking at those kind of things. And then I'll go out on the floor, and we have almost 200 residents. So I walk around the building and kind of go to each nursing station and find out what the needs are for the day. And, you know, there are times where it takes me, you know, all day just to get from one side of the building to the other because the needs are, there's a lot of needs.
Right.
And there are times when we have, you know, someone who's passing. And in the event that I know that someone is getting close, then I visit frequently. Sometimes I'm sitting with the resident and, you know, helping them. Sometimes I'm helping support the families. Sometimes it's just hospitality. You know, I'm just doing everything that I can to help support them. I'm also there for the staff. So if there's a staff need, you know, I provide support and counseling, whether it be emotional issues or whether they be spiritual issues. I do devotions for the residents. I have Bible studies for the residents. I pray for their meal times. We have a church service once a week. So there's a lot of variety, but as I said, you know, that's what I enjoy. And I also provide support to the families and follow up after deaths to make sure everybody's doing okay.
Yeah, because, you know, especially what we were talking about earlier, you know, a lot of your job is getting someone ready for death, or at least
at
least giving them the information that, you know, you align with and things like that, and the person, you know, not getting right and whatnot. But a lot of people, I mean, after death care, and you talk about, you know, the staff with like the grief counseling and things like that, you know, that's pretty interesting because, you know, the typical role that I see of a chaplain that we've all seen, you know, or something like that, you know, you do your services and things like that. So what got you into this field? Because I don't want to say it's odd.
It is odd.
Well,
there's not very many people like me that get interested.
No, I mean, I've known you for 4 years or so.
Yes.
You know, I mean, you seem to have the personality that this is a caretaking type job. But I guess if you could just kind of go through, you know, what brought you to be a chaplain, I guess, you know.
Sure. Well, I can tell you when I was a young girl, I had no idea what a chaplain was. So that wasn't my lifelong dream. You know, I wanted to be a dancer.
I want to dance.
Completely, you know, opposite of what I'm doing today. Early in our marriage, we lost a child, and through the death of our son Jacob, that brought me to a personal exploration of what did that mean? What did Jacob experience? What was it like for him? Where is he now? I had to really come to grips with what I believed and how strong was my faith. And so, that wasn't an easy task.
No.
But what I found was the more that I educated myself, the more peace I found with the process. And that was part of my grieving. And then, I was a stay-at-home mom for 13 years, and just dawned on me one day that my kids were actually going to all go to school. I don't know why I never thought of it before. So I was trying to figure out what I was going to do. I'd spent a lot of time in church ministry, doing everything from being literally the cleaning lady to eventually, after I went to school, serving as associate pastor. Decided to go back to school, and I was very gifted that my husband gave me the great blessing to just go after what my heart's desired. He told me not to worry about how much money I would make or what it would look like or what it would feel like, just to do what I wanted to do. And he said, I don't even care if you use your degree. I think you need to do this. And that was a huge blessing. So I went into ministry, and I was looking to possibly go into biblical counseling. And about halfway through getting my ministry degree, my husband's grandmother was on hospice care. That was my first experience with hospice. She was in a freestanding hospice center in Columbus, Indiana, and it was beautiful. I was in awe of the care and the professionalism that was taking place, and I'd experienced lots of deaths of family members in the hospital setting, but never in a hospice setting. And I was so impressed with the chaplain that came in and spent time with his grandmother, spent an hour with her. And it wasn't just one of these, when you've got a loved one that's dying in the hospital, it's in and out. You got to think of those answers really, your questions really quick, because you're just trying to think of everything because that doctor is going to be gone again. Well, this was a completely different setting. It was peaceful. She was in this big room. Her needs were being met, not only her physical needs, but also her spiritual, her emotional needs. The family was welcome to stay in the room with her. The chaplain stayed for an hour.
Wow.
He sung hymns to her. He asked her things about her life. He really made it personal, and it was about her, and it was her experience. And I just thought that was something I'd never witnessed before. So when we left there, I told my husband, I think this is what I want to do. I said, I don't know if my degree will even qualify. So his answer to me was, when we get home, I think you should call every hospice in town and find out if your degree would qualify or what you need. And I didn't do that. I thought it was a great idea, but I didn't do it.
Yeah.
So I kept trucking along. And then one day I had a dream. And in the dream, my husband was bringing me a young man that was dying and a baby that was dying. And he put them both, brought them to me, and he left. And I said, what are you doing? And he said, they're dying and they need you. And I said, I don't know what to do. And he said, yes, you do. And he walked away. And so when I woke up, I knew that was my sign. Uh-huh. So I called every hospice in town, and I found one that was willing to give me an internship. Took the internship because with a unique field like end-of-life care, you may think that that's what you want to do, but really you kind of got to get into it to understand if it's really for you or not, because there's a lot of things you cannot prepare yourself for.
Oh, most definitely, yeah.
Yeah, so that's what I did, and I fell in love with it and was hired very quickly after that and finished my degree, and the rest is history. So I continued my education with getting a certification in grief counseling and pastoral thanatology, so that just helped me really be better at what I was doing.
Oh, definitely. Pad the stats a little bit,
Yeah. Well, not just that, but, it's very important to me when you're dealing with the nature of work that I do, that I am offering my best to people, because it's a time when they need you the most. And not everybody wants to work in this field. It is a rare, thing to, I think, be interested in. But at the same time, I know that many people are maybe walking away because it's uncomfortable. So I want to make sure that I'm doing my best
Yeah.
to offer them everything I can.
Yeah, that's definitely. I mean, it's not a field we hear of a lot.
No.
My degree's in psychology, so I mean, I know a little bit about death. I mean, not an expert, especially like you. Definitely not an expert on it, but a lot of that does drive people away because we sit there and look at our own mortality in a way, and we're like, try to make your peace with God or whatever you believe in type thing. So I could see that. And you've done this for what, 25 years? Or
I did church ministry for 25 years, end of life for about 10 years.
About 10 years, and especially in the 10 years, what kind of changes have you seen? You said you went and expanded on your education,
yes.
with the grief counseling and things like that. I mean, are there any changes that kind of pop up in your mind that you've seen in the last 10 years? Or?
In the industry?
Yes, in the industry, sorry.
Well, I will say that, with all the advancements in technology, most things that we see in our world today, we can see that we benefited with time, that technology has been more improved, that things are faster, stronger than they've ever been. And I don't think this is true when you're dealing with grief and loss and death. I think that we've actually, in a way, gone backwards. Years ago, especially with grief, we had periods of mourning where we respected those that had had a significant loss. So when I'm talking about a significant loss, I mean someone like maybe a spouse or a child or even a parent, that when that death happens, it changes your life.
Oh, most definitely. Yeah. It's a major life event.
Yes.
Major trauma
yes.
too, a lot of times.
And not every single death changes our everyday, but there are some deaths that do.
Oh, most
and
definitely.
So being able to wear black and be in a period of mourning where people were sensitive to you and you weren't expected to do the things that you did before, in a way, that's really quite beautiful. And today I find that we're rushing everything. Funeral services are actually becoming shorter. People are doing less. They don't see the significance in it. And I almost think it's the culture of we're living longer. And so we're avoiding death more so than ever. Huh. And death is very much a part of life.
Yeah,
there's few things in life that we can say every single person will have in common. Birth and death are both
taxes.
Yeah, exactly. Birth, death, and taxes. There you go.
Right.
So I think that, like I said before, knowledge is power. I think that's why I'm so passionate about what I do, is to educate people, to take any opportunity I can to help people to understand the dying process and to not be so freaked out by it, so that you can make the most of the time you have. I think when you understand the dying process and can respect it just like we do the birth process, then you live a better life. And, that's something I tell my colleagues, that we're fools if we are going to sit by people and watch them die and help support them when they die, and we don't make better choices for ourselves. We're absolute fools, because we should spend time with our patients who are dying and get their perspective and learn from them, because they have a perspective that we will not be able to obtain until it's too late.
Yeah, you're definitely right. That's kind of like with our projects that we've set up, especially with the podcast. And I run a site. It's for veterans more so, with mental health and things like that. There's a large stigma on that. And I just was thinking with the end of life stuff like you were talking about. We put a lot of emphasis on birth.
Yes, we do.
A lot of emphasis. We sit here and we buy the crib and we buy the bouncy house and we buy all these things, but when it comes to death, it's like it's taboo.
Yes.
Especially in American society, and there's other societies that have a more favorable view on death and religious wise, things like that. And it's funny you talked about the mourning. I've been going to Jewish temple for about 8 months or so like that, and they have a
Shiva?
No, yeah, a sitting Shiva.
Yes, it's beautiful.
10 days.
Yes.
10 days, like.
I use that a lot when I'm talking to people because I think it's beautiful.
Yeah, and that's exactly right. And we live more so in a culture that we are go go go.
Yes.
Want to just get done and be done with it. But you know what? That's funny. I've never had that. I never really thought about death as they have the celebration of life and all
Yes.
that. And I thought that's pretty interesting, because growing up, just go to the funeral or go to the wake or
Right.
or whatever, and I would definitely see where we could put more emphasis, especially on death.
Yes.
I mean, as scary as it is to, not know, but, if you can make your peace and find some sort of solace in it, then why not do it?
Well, like you said, when you're when you're pregnant and you're preparing for the birth of the child, you've got 9 months, right?
Yes.
You read everything you possibly can. Most people do.
Oh, yeah.
You
read
wanted
the books. I want to choose a
Yes.
name and all
Yeah,
this.
and you talk to people, you want advice. There is so much preparation that goes into that. You're talking to your doctor on a regular basis. You're creating a birth plan, and you're actually not only creating a birth plan, but you also start to think of, if something goes wrong, what's the next set of criteria that we want to go to? If we can't have a natural birth, then, how are we going to manage this? And yet we have our whole lives to plan for our death, and we aren't doing those things. And so a lot of the people that I talk to are, they have this quote unquote death sentence, where they've got this X amount of time.
Yeah, they're terminal. I mean, they're terminal.
Yeah. And at that point, that's the first time that they're thinking about this, where I think, it's healthier if we start thinking now while we're healthy, the things that we want and the things that are important to us, so that when that time comes, number one, you're not so freaked out by it, but number two, that you make it impactful, that you create a beautiful moment out of it, and you leave a legacy behind.
Yeah, most definitely. And that's what a lot of things, let their memory be a blessing.
Yes.
And that's what a lot of people don't think. You think, okay, someone's dead and that's it, and we forget about them. No, that's not it for people. It's not it for people.
It's not.
Especially we've went through death, and we've experienced death and grieving. And I've been in a situation. My sister lost a child right away. I mean, young. I mean, just same day. And that's terrible.
It is.
It's terrible, and I don't wish that upon anybody. But no one death is greater than the other one. But the more that we know, and like I like what you're saying here, the more education that we have behind it, maybe the better we can facilitate it, and more so with our society, anyways. Especially, the birth is such a joyous occasion and things like that, and death's always seen. We see it in the movies where it's raining and everybody's wearing all black, and the guy throws some dirt on somebody and that's it. And I don't know how we could necessarily change that as a culture.
Right.
It would be nice, obviously, if we could, but
I think education.
Yeah.
And, there's a lot of similarities to birth and death.
Yeah.
I use this a lot when I'm talking to people, because births can be messy. Mm-hmm. They can be complicated. They can be confusing. They can also be beautiful. And death is the same. It really is. And there's no two births that are alike.
No.
And, when we want to be surrounded by the people we love. And it's really kind of the same, on both ends of the spectrum.
Yeah, definitely. That's the thing, that we don't sit here and look at it that way. And I don't know what kind of paradigm shift we would need to look at it that way, but more so, your message in ministries and whatnot. And I know you run a site, Powell Ministries. If you would, just kind of take me through, why you set this up, what your guys' mission is, what your mission is, on that, and just whatever else you want to include.
Okay, wonderful. Well, the vision for the ministry came about 14 years ago. And when I had little kids at my feet, and I was a stay-at-home mom, and I thought it was absolutely kind of crazy. I just kind of had this, this vision in my mind. This image popped into my head, and it was of me speaking in front of people. And at the time, there was a lady I used to watch on TV all the time, and her name was Joyce Meyer Ministries.
Yeah, I know.
And I thought, man, I'm watching too much Joyce Meyers. It's like,
in your head.
Yeah, it's in my head. And I just thought it was crazy. But through the years, the Lord has reminded me of that vision. And he's also planted other seeds that let me know that one day I would be doing that. And I've really just trusted God and never wanted to make it my own. I never wanted to go out and push to have my voice out there until it was the right time, and just knowing that he was going to put before me what I needed. And last year it came to a point where I knew the door was open and I needed to walk through it. So I actually started my ministry, launched my ministry on the anniversary of my son's death, because that is really, my experience, my grief experience was really brought me to a deeper faith, and to know God in more of a tangible way, and to know, to really rely on him. And he pulled me out of a pit I couldn't pull myself out of in my grief and my loss. And at that point, I gave not only just, I'd already given my heart to him, so to speak, but I kind of gave my future to him, just said, I'll serve you in whatever way that you see fit. And so, it led up to now. And so on the anniversary of his death, we launched the ministry, which I thought was very fitting. It was kind of a full circle moment,
right,
for what the enemy meant for harm, the Lord meant for good. And so my website is TaraPowellMinistries.com, and it's got a lot of resources for grief and end of life. There's some frequently asked questions of folks who are grieving. Grieving can kind of feel like a stigma, because people are so uncomfortable with our pain that most people don't want to sit and have a conversation about your heartache and your struggle and let you cry. And really, that's the absolute best thing we can do, because we were created to grieve. It's a part of who we are. And so we're actually healthier and better if we do the grieving process than trying to just stuff it and keep, going through life. Because what will happen is, if you stuff it and you don't deal with it, it doesn't go away. It lays dormant in you, and it will creep back up. And when it creeps back up, it might be 6 months later, 6 years later, and it may even start to come out in your health. So there's really no way to get over grieving except for to go through it. So those resources on there, but also if you're facing death yourself, I've dealt with many patients that had no one else to talk to, because anytime that they mentioned something, people thought they were morbid, and they stopped them. They would say, don't say things like that, and so they had no one to talk to. And just think of experiencing that yourself. If you know that you're dying, and there's things you want to say to the people you love, and there's things you want to talk through, your fears, your faith, whatever, and no one will let you talk. Yeah, because they're so afraid of it. And so
that's crazy, though.
Yeah,
it
is crazy, but it's true.
Well, especially with loved ones. I couldn't think to myself, let's just say grandparent, parent, sibling, wife, spouse, whomever, is there, and they want to talk about, their feelings, and they get the opportunity to do it. We see a lot of people, when they have a tragic death, I don't want to say catastrophic, but a tragic death, that somebody gets in a car wreck, somebody dies. Right. I always wanted to, tell them this, or I wanted, just tell them this, or I just wanted one more day to do this or do that, and that's, I think, to miss out on the opportunity to actually talk to somebody about how they're feeling.
Yes, that's
in
the
that
gift.
Stage of their life. That's it.
That's the gift.
I believe that would give me more closure than saying, well, I wish I would have told so-and-so I loved them, or, I wish I would have told so-and-so how I really felt.
And you just hit on it. Actually, you hit on it. What amazed me with my education and with my experience is I realized that it's more basic than what anybody ever imagines, because it really just boils down to getting back down to humanity and being able to connect with another person on such a basic level of knowing that when we allow ourselves to grieve, when we tap into the emotions, we're actually better for it, and we are already equipped to handle it. We're just so afraid of it that we just, we keep it at arm's distance. And like when you have a loved one that's dying, having those conversations are healing. Yeah. They're healing for you, they're healing for them. And really, grief starts from the moment of diagnosis. Yeah. It really does. So you're grieving a little bit at a time, you just don't recognize it. And everybody's so afraid of that final moment. But when you're preparing for that final moment, and I've been there and I've seen some really beautiful endings, and that's been when people have been preparing for it, and it's like crossing that finish line. You know, like when you're running a marathon and you've prepared for this, and you're tired and you're worn out and you don't think you can make it another step, and then you cross that finish line, and I call it the finish line of faith. You know, and once they cross that finish line of faith, there's nothing waiting for them but rest and reward. It's over, but over in a good way for them, you know. For us, of course, there's going to be sorrow, and, you know, I'm not trying to take the sadness out of it, because sadness is just part of it.
Oh, most definitely. You know, you lose a integral part of your life, you know, somebody that's important to you.
Absolutely.
You know, and it's, people grieve differently too. You know, that's one of the things. And like we talked about with the Kubler-Ross stages of grief, you know, it's not a linear path. It's not a linear path, you know. Maybe you get angry first. Maybe you deny first. Maybe you accept it right off the bat. Who knows? You know, and that's what it gets at, you know.
And it's all okay.
Yeah, most definitely it is. You know, we're human beings, and we have to have certain needs met. You know, we have to eat, we have to do this and things like that. But I think a lot of the times we kind of shy away from our mental health.
We do.
In our emotions and things like that. We don't want to talk about our emotions. We don't want to, you know, do this and feel vulnerable and things like that. And I think more so through education, like you're talking about, and especially with grief in a culture like ours, I would like to see a path, because, you know, whenever I think of grief and into life decisions and things like that, you know, I kind of think of it as a clinical. You know, you're here and we're going to give you some sort of palliative care, or you're going to sit here, you're going to take a pill and just whatever, you know, you're going to pass on. But actually having that emotional behind that, spiritual things of that nature, I mean, it's really, really relieving to have. So, I mean, that's crazy. And I hate to say that.
Yeah,
like, it's crazy,
well,
but
and the more holistic things can be, you know, sometimes medicines get in the way. Sometimes medicines are complicating things. You know, one of the biggest battles we have when we're dealing with end of life is, you know, our bodies start to not want food because, number one, we're not burning fuel. But another reason is food can start to be painful and get in the way, actually. But it can make somebody choke, and, you know, we love people, so we want our loved one to eat, and we don't want them to starve to death, you know, so we have all these fears related to end of life. But when we trust the body and we just follow its lead, if somebody's hungry, they can eat. And if they're thirsty, they can drink. But if they're not wanting it, there's a reason. Yeah. And we just have to trust that. So the more holistic we are in our approach to end of life is really the better. And I think that's what's so hard for people to understand, because in their minds, it's giving up. When you pull things back, that you're giving up. But it's not giving up. It's just changing the way you're viewing it, and you're providing comfort, and you're just listening to the person and what they need. Yeah.
You know, your body's going to tell you what you want. You know, we go through our hierarchy of needs, you know,
yes.
Our Henry Maslow, good stuff like that, you know, making these leaps and bounds. And I never thought about more so, you know, because we think hospice, we think, you know, palliative care, we think give them medicine, make them comfortable. You know, we do make them comfortable, but like you're talking about, you know, feeding someone, well, maybe that's uncomfortable.
Exactly.
You know, and why not, like you're saying, you know, just take the lead. I mean, whatever you believe in and things like that, you know, why not let this person decide what they want to do? You know, and we run into a lot of legal situations on that. You know, you remember, this is kind of out of the realm of hospice care, but you remember Terry Schiavo years back.
Yes, I do.
You know, and they had so many legal issues with that, and, you know, it took 7 years. It took 7 years to finally get the plug pulled on her. I mean, what kind of quality of life? I mean, you're looking at quality of life issues with that, and I don't know. But I think, like you're saying, you know, if we take a more holistic view on this, maybe it'll pay dividends behind it. You know, we're such a standardized and clinical type culture when it comes to medicine.
We are.
You know, you go into the doctor and say, I got the sniffles or whatever, and they look through a little book. Okay, you know, take this medicine. You go to a therapist or something and say, hey, I feel blue. They pull out a DSM-5 and say, okay, well, you may have this, and this. Here's some medicine. Go on your way type deal. But maybe if we actually take the time to look at maybe some different alternative methods.
We treat the symptoms.
Yes, that's
instead
exactly
of the person.
It. Oh, that's exactly it.
Yeah, and, you know, I think it's important to have conversations early. You know, I'm not trying to be morbid, but, you know, my husband, we've talked to our kids about these kind of things, and we have conversations about what we would want, because we don't know when that moment happens, that you're in a car wreck or that something out of the blue. You know, these conversations shouldn't wait till we're 70.
No.
They should be happening, you know, when we're in our 20s and when we're in our 30s. And the thing is, those answers evolve with us, because as we age, we start to look at things a little differently, and as we start to have experiences. But to say, hey, you know, if I'm not able to speak, if I'm not able to move, don't put me on a feeding tube. Don't, you know, just to have those conversations. It's so important.
Yeah, you know, you got advanced living will, you know,
Yes.
DNR and things like that, you know, and to respect your wishes behind it, you know, that's interesting. And I don't believe it's morbid either. You know, that's where the change needs to take place, and especially with our society, to say, okay, you know, birth is a beautiful thing, and it can be a messy
Yes.
thing, or it can be a bad thing, or it can be all of these different emotions or monikers that you want to put on it. But like you've talked about in the beginning there, you know, death can be beautiful.
It is.
You know, and if you look past a lot of it, or look into it introspectively at yourself, you know, it just kind of comes down to your faith-based systems and things like that, you know, and that's what the change can take place, but I don't know how long a change would take place. You know what I'm saying?
Well,
I mean, that's the
that's
bad
true.
thing about it.
And you know what? Yes, my faith beliefs are very strong, but you know, it's so important to me that when I'm caring for someone, that what they believe is being held in great respect, and that they are treated with absolute dignity. So even when they believe completely opposite of me, or they're wanting to do things that I personally don't think is best because of my experience, there is something really valuable about knowing that you are honoring someone's wishes.
Oh yeah, I mean, most definitely. And the thing is, you know, you're more so there. You know, we see a lot of time with religion and things like that. You know, people get to these things. You know, you must believe in this, or
That's
this
right.
is going to happen. I think more so the role that you're describing is, you know, you're giving the information out. And you're telling what you believe, and like you're talking about, it may not be something that person believes or anything like that, but you're giving the information. And
Right.
If they take it and run with it, fine. If they don't, fine. But you're still there too, you know, with the religious standpoint as well, is to give some sort of clarity of what you know through the grieving process, you know, and
Right.
I think that's really neat, for lack of better terms, you know.
Yes.
I mean, really it is.
Well, one of my favorite quotes is that I dance with all my patients, but I always let them lead. I guess that goes back to the little girl who wanted to be a dancer, right?
Yeah, that's funny. Yeah, you see, you tied it
Yeah,
all
I
together
did.
again. Awesome.
But truth is, you know, you have to let your patient lead the conversation. Some people aren't ready to dive in deep, like maybe you think they need to, because you know that time is not on their side, but it's really about them. And, you know, understanding my viewpoint is not really to supply them with answers. It's to ask the questions, because we usually have the answers in us. It's just offering a space that they feel safe in, that they know you're not going to judge them, and that you ask the right questions. And when you ask the right questions, it opens little doors of opportunity. And if they want to walk through that door, you walk with them. And if they don't, then you let it be.
Yeah, you've shown them the door, you know, and it kind of comes to the old adage, you know, you can lead a horse to water, but
Exactly.
you can't make them drink.
Yeah.
Yeah, where's I going with this? That's why I love these, anyways.
Now you can edit that
No,
out and come back to
definitely.
it.
No, it's fine. Yeah, I can definitely do that. No, I think there's a cathartic position on that, more so, you know, you let the patient talk, and
Right.
whatever they want to talk about and what they view as being important, you know, and if they have questions for you, obviously they're going to ask you the questions, but, you know,
Right.
if you let them lead the discussion and go from there, you know, it really probably helps them out emotionally anyways, you know, and especially some that, you know, a lot of these patients are really old, you know, not for lack of better terms, but I mean, where are their friends, where are their support system, you know, where's their wife or kids or something like that? They may not have any. So
That's
I mean,
right.
that has to be super hard too, especially with going into the unknown, air quotes, unknown. I just, you know, how do you deal with that with somebody that, you know, you're the only refuge they have, I guess?
Well, I just be that refuge. I mean, I'm not trying to make it sound more glamorous than what it is, but just, I think the best thing I do for people is show up. I show up and I'm present, and presence is healing. Just offering someplace, one of the things that I'll say is the best thing you can do for somebody when they're grieving is hold them while they cry. It's not a 12-step program. It's not, do this and do that and then you'll feel better. As a grief counselor, many times, that's the struggle is, you can't make it better. You can't offer them this one or two, punch thing that's going to work.
Yeah,
but
take the red pill or take the blue pill,
exactly.
and then this will make it better.
Right, and people want that. People show up for counseling because they want that. And I think they can feel a little discouraged when they find out that, no, this is a process, and processes aren't comfortable. They're not necessarily always pretty. They can be complicated, but it is the best way, is to listen to yourself. I think that's the hardest thing to do in grieving is we have to examine our own hearts. We have to figure out, what do I believe? Where am I in this? And that's the biggest struggle. Like you'd mentioned, being vulnerable. I'll never forget when we moved to Evansville, and I had, I was a stay-at-home mom, and we had just moved here. It was about 15 years ago, and I was driving down the Lloyds Expressway, and I had these 3 cute kids sitting in the back, and I got this, good marriage and everything, and I was involved in a MOPS program, which is a Mothers of Preschoolers, and I thought, I had this great idea, this brilliant idea, that no one had to know that we'd lost a child. No one had to know of the death of our son. We weren't living in our small town anymore where everybody knew our name and everybody knew what happened and you had people's sympathy and pity. And so we could just pretend to be this great idealistic family, and, this big grin got across my face. And I heard the Lord tell me that I can't use you. And it was like, wow, burst my bubble. That's not going to work. Great. I promised that I would serve God and do whatever he told me to. So I had to kind of back the train up and go, okay, this is who I am and this is what it's about. And I find that when I'm working with individuals, along with my Powell ministries, but also, as a chaplain, that I have to be willing to tap into my own pain. It's not about me, but being willing myself to be vulnerable allows them to feel safe to be vulnerable.
Yeah, and that brings up a really good point, that relatability behind a lot of these topics, and going back to some of the stuff that I run and my friends and stuff like that, I spent 6 years active duty Air Force. I got out of high school, went to the Air Force, had all these great life experiences and had some not so great life experiences and things like that. And at the time, I struggle with mental health issues and as well, and I tell people on this show all the time because me talking about my issues, and it's not me, oh, pity me, I want your pity, I want this, I want that. But if somebody's out there and they're listening and I can say, hey, I've been through this.
Yes.
And what's so interesting about this, though, is that I talked to buddies of mine. I said, man, I'm feeling like this. I said, yeah, I felt like that for years. Well, I thought I was the only one. Well, I thought I was the only one, too.
Exactly.
And you get out there and you network and things like that, So for you to, you say, you moved down here and you were thinking, I don't have to know this. I don't need the pity of things like that.
That's right.
But you've taken it to, to work within your powers, and what you want to do is that you talk about your experiences and although they may be uncomfortable, a lot of mine are uncomfortable to talk about. But at the same time, if I can sit there and put that information out there of what I've experienced, and you sit there and say, by golly, I experienced this too.
Right.
Then we have this connection here, and I think it's really good, especially with the technology. We kind of hit on technology earlier just with end-of-life stuff, but more so with the technology we have right here. We're sitting here on a laptop talking. We can sit here, we can go on Facebook, and we can do this. We can go on social media. We can set up pages. The information is out there, and all we have to do is deliver.
Right.
And it's kind of like you're talking about the doors, we sit there, you deliver the door, and whatever you do after that, it's what you do. So,
well, that's why I do what I do. I mean, any opportunity that people will give me to talk about grief and end of life, I do it because of that. Because I know that there are millions of people that are facing death or have encountered death, and they're struggling and they're in a dark place. And people don't know what to do about it. They don't know how to talk about it. So I make myself willing to talk about it in hopes that we start these conversations so that it's not this forbidden thing, that it's not in the dark anymore, that we're having these conversations and that we get more comfortable with allowing people to share their suffering.
Yeah, most definitely, and we have these relatable experiences, just even locally, you could start groups, and I know you start your terrapalministries.com,
Yes.
And that's a great thing, especially with people trying to find some sort of information or some sort of solace in these into life decisions. And I think you're doing a great thing. Not to toot your own horn, but I mean it's really good to people like you are out here and willing to talk about a topic that's so, I don't want to say taboo,
but it is.
But it is.
Let's be honest. Let's just call it what it is.
Yeah, I mean it is. I mean it really is taboo to talk about death. So.
I know. I wish it wasn't.
No, and exactly. And we can making those shifts, and just little by little, especially with websites and people finding relatability behind it. People don't have to sit here and sit in the house and have their emotions and then go out and try to be something else.
Right.
If people can sit there, they can be the agents of change on this and be the catalyst behind it, which
Agreed.
I find really, really promising anyway. So, Tara, I appreciate your time, and goodness, I'm happy about grieving. I can't believe that. I wasn't necessarily sure what I was going to talk about or how it went, but I appreciate you taking the time to talk to me about grieving in the process. So thank you very much.
Thank you.